Welcome to Startup Health TV. This is a special COVID-19 health innovation update. I'm Logan Plaster, editor of Startup Health magazine, and I have the pleasure of being joined today by Shireen Abdullah, the CEO and founder of Yumlish. Shireen, thank you for joining me for a quick conversation about what you're working on.
Thanks for having me.
So what we've been doing on the show are these health innovation updates is really learning about how healthcare entrepreneurs are either pivoting or kind of reframing the work they're doing around the COVID-19 pandemic and also preparing for a post-pandemic world, kind of what's next. So let's start by just having you lay the foundation for what Yumlish is and what's the work that you're doing currently.
Yeah, so with Yumlish, what we do is we provide a way for people with diabetes specifically and their chronic illnesses be able to manage their conditions. So for diabetes, it largely comes down to managing A1C levels, and we do that through diet, exercise, really work with a person where they are. And what is unique about our approach, Logan, is we look at providing nutrition therapy from a cultural relevance lens. And so what that means is we look at the person's cultural background, their country of origin, to provide them nutrition therapy that makes sense for them. So it's very personalized from that sense. We also address.
Give me an example.
Yeah. So currently we work with clinics, and so these are clinics largely Hispanic, low-income individuals. So we work with them to provide them nutrition therapy when it makes sense for how do you look at tacos differently, right? Now we're looking at lettuce wrap tacos. What is the nutrition value from that? Walking them through foods that make sense to them and apply to them. We also look at socioeconomic barriers. So we start looking at food pantry solutions in the area, things like that, that can help sort of close some of those environmental factors that may keep them from being dietary adherent.
Gotcha. So having that lens must have really sort of teed you up well for this period that we're in now, where food insecurity has been heightened to such a degree. So kind of how are you thinking about the current food landscape and how it affects what Yumlish is doing?
Absolutely. So we still continue to work with those partners in the community to help address those concerns, and now more than ever. We're starting to see shortages in these pantries. We're doing what we can. We work with various sorts of partners here and where we are located in Dallas, Texas, to help close some of those gaps. We also work closely with grocers, and again, in just making that effort to close those gaps for our participants. Specifically for COVID, what we're seeing right now, Logan, is a lot of the people who have things like diabetes, and again, just harping on that, people with diabetes have an increased risk of complications from COVID-19. And what we do know is that managed diabetes can help reduce some of those complications. So as we're sort of looking further now out into the future and looking at a second wave, perhaps, or even a third wave of this virus, what we need to do is work to manage that diabetes today in our communities, in order to reduce that impact and those complications that may be coming on. Also, one of the other things right now and today, as you can see, our lifestyle has changed. You would have seen my work behind me, but this is at home right now. But as our lifestyle has changed and now we're indoors, for someone with diabetes, that impacts their A1C levels. They're not as active as they used to be. So even without a COVID contraction, unfortunately, just being indoors a lot, people need to learn how to manage their A1Cs in this new modified lifestyle. So given those two circumstances, those two certain tracks, we're working hard to sort of manage that diabetes and again, control those A1Cs.
Is there any way that you can quantify and help viewers understand just how big of a risk this is when you have a better understanding of the diabetes market, the type 2 diabetes market? Do you have ways internally of quantifying what this amount of sedentary life is going to do, is negatively going to impact this population of patients?
We haven't quite quantified it, but what we do know is that we need to work towards safe weight loss, which is for 90% of the time that tends to be the case, is that weight loss needs to be consistent. It needs to be ongoing in order to impact A1C. And A1C is impacted in a matter of months, right? So for us, it is very, very important to look at that and intervene sooner rather than later, because the more we wait, the more catch up we have to do in order to maintain and manage this.
Yeah. It's an interesting angle that you're taking in terms of really looking at food insecurity and food banks, the kind of food people are getting in this moment. I wonder if you can share any just practical wisdom for being at home, trying to cook healthy, maybe for someone who has limited resources. What are the types of what's the type of advice you're sharing right now?
hmm What we're doing it well, a couple of things. So we're putting out recipes, virtual cooking demonstrations and things like that because we can't meet people where they are right now. So doing a lot of virtual cooking demonstrations. Our programs are actually offered for the most part virtually as well.
Okay.
So what we do is over group telehealth sessions, our registered dietitians sort of work with the groups to understand what their needs are, sort of provide nutrition therapy to that. And so we work very closely with them to understand sort of where they are, what sort of help they need, and then just providing them content. So these are recipes we're putting out to them. A lot of people are cooking more at home, more than usual. I know I
Mm-hmm.
am.
Mm-hmm.
And so just really giving them recipes and those type of solutions. We're also working with partner agencies, like I was talking about the food insecurity piece. We're working with partner agencies to try to close some of those gaps. We're not, we're trying to do the best that we can in this scenario. It may not be perfect, but we're definitely working hard at it.
So it sounds like what I'm hearing you saying is there's a very personalized element to this where you could be part of a group telehealth chat and actually present to a dietitian, okay, here are my limitations. Here's the kind of food I'm getting, whether I'm picking it up at the local public school or the food bank or my grocery store has limited resources. Here's what I've got. Now help me do the best I can with this. Is
hmm
that right? Is that
And
right?
yeah, and so the registered dietitian really helps them understand these are carbs and these are, they help them understand what the different foods are. We work with them. Our admin team really works very closely with them to understand, hey, these are recipes that work well for you. Sometimes what we hear is there's a dietary restriction. A kid may have a nut allergy, things like that, or an insensitivity to gluten. Again, work with them very, very closely to provide them those recipes that are relevant to them.
One of the big themes of the pandemic has been this idea that while all the focus is on COVID-19, no other chronic condition is going away. And so there
Mhm.
is this sort of a backlog, this potential for a secondary wave of chronic illness uh, as the negative effects kind of pile up. What's your sense from the diabetes community in terms of what we should be looking ahead for, preparing for? What are sort of I don't know, the conditions that you see happening right now?
We unfortunately, given the circumstances, you can imagine we're starting to see a ripple effect. Like I mentioned earlier, even if there isn't a COVID-19 contraction, we can already tell with this lifestyle, just the lifestyle in itself is going to start having an impact on A1Cs. It's going to start on a day-to-day basis is impacting blood sugar levels. It's going to start impacting your A1Cs, things like that. Another key element to this is anxiety. People losing their jobs. All of that is sort of taking this cumulative, unfortunately, negative impact onto this community that's already vulnerable to begin with,
Yeah.
right? So if this is not managed in a sustainable way, if this is not managed in a way that's applicable to where the people are in the lifestyle that they're living today, it will have a ripple effect, unfortunately, on A1Cs.
Yeah. Yeah. On a positive side, we're seeing an uptick in adoption of telemedicine resources, telehealth resources, virtual care in general. Have you seen, or how have you seen people migrating towards a service like Yumlish? Has their perspective on it changed in the last month? And how do you see that impacting the business post-pandemic?
Absolutely. I think there's a lot more openness to that. And really, one of the things that has come out of this, a silver lining of sorts, if you will, is that openness to embracing telehealth. Before, the conversations that we used to have around telehealth were, I don't know about user adoption. I don't know how people will react or respond to this. And today there's an openness, and actually people are seeking out telehealth options, which was quite rare before. So it's good to be able to see that for sure.
Very nice. You call yourself on LinkedIn that your company's chief foodie. So I have to ask you, what is your favorite thing to cook?
Oh, wow. This is a good one. Turkey tacos.
Turkey tacos.
Yes,
Okay.
but lettuce wrap. No carbs.
Lettuce wrap turkey tacos.
Yes.
What do you put into it? Give me some
Oh,
Yumlish
yeah.
details.
All right. I mean, it's super, super simple. You start with some lean ground turkey meat,
Hmm.
throw in some spices. You could do cumin. You could also spice it up with some red pepper, chili flakes, those type of things. Super simple. We're just olive oil. Just make it in olive oil. Don't complicate it a lot. Actually, if you've got some other spices that you like using, throw those in. What I'm trying to say is you can't go wrong with turkey tacos. You can
Okay.
make them
Okay.
whichever way you want. And then use some iceberg lettuce or butter lettuce. Actually,
Hmm.
it gives you a little creamier texture.
Nice.
Skip the sour cream, throw
Okay.
it in, top it off with some sliced avocados. Go to
Mm.
town.
Spicy or not spicy?
Definitely spicy.
You like it hot.
I do.
Very nice.
I'm a
Very
brown
nice.
person, Logan. I love my spice.
Well, and you're in Texas,
I
so
am.
you have your
So,
choice of hot sauces, right?
yeah, absolutely.
How long have you lived
Absolutely.
in Texas?
Oh boy, it has been a number of years. Without giving my age away, a number of years.
What is we can wrap up with this, but what is the health tech ecosystem like in Texas? So many of our companies are in New York or in San Francisco or Boston. What's it like building Yumlish in Texas?
Well, health tech wise, we do have an ecosystem here that we've got large medical districts out in Houston and in Dallas. So we have a lot of health systems, and as you can again, unfortunately, imagine in Texas, we love our fried foods. If you look at
Sure.
the statistics overall in the nation, Texas ranks pretty high up in obesity and some of those illnesses. Even for diabetes, we're sort of pulling ahead of the U.S. Population statistics on when it comes to diabetes, unfortunately. Um, so I hate to say this, but business is good.
Yeah. No, I mean
We've got, yeah.
you're on the front lines, and
Yes.
there are. I mean, I ask that partially because I know there are great benefits to getting
Mhm.
out of these top metro areas and having relationships with hospital systems, around the country, and seeing some of these problems right there on the front lines when it
Mhm.
comes to diet, obesity. Yeah.
Yeah, so we see a lot of this in our backyard here here in Dallas. Actually, there are lots of pockets around town that have that don't have as much access to nutrition therapy. Things that may be common knowledge to you and I are not common knowledge to everyone, especially when it comes to ethnic foods. So we work really hard in our community to make sure that those nutritional gaps are filled, and then we have a path for them to dietary adherence. It doesn't have to be this is the end for me. Diabetes is going to take me out. It's nothing like that. We work very closely with them to understand that they're in the driver's seat of their health, and that's the kind of empowerment that has been lacking in their in sort of their journey so far. And so we put them in the driver's seat of their health, and just empowering them to start to make those day-to-day changes and how they can impact their blood glucose and A1C has a ripple effect. And a part of our solution is that we call ourselves AA for diet, because the community engagement and the support is really so strong. And you need that. You need that to help someone to understand exactly what their foods need to look like and how they can change and impact the health outcomes not only for themselves but their families too.
Well, Shireen, that's an awesome note to end on. Thank you so much for the work that you're doing for really at-risk populations, helping them with diet, their chronic diseases, type 2 diabetes, et cetera. So thank you, and we'll be watching Yumlish for what you work on next. Stay healthy.
Thank you. Thank you.